From the News Channel 5 network, this is Pharmacist On Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky, those parts of West Tennessee. Welcome to Pharmacist On Call with your host, Dr. Shawn Pruitt, owner of the Kangen Water Store of Nashville, owner of Pruitt's Discount Pharmacy. And if you are watching this show, I am your community pharmacist. Well, everyone, welcome to the show. I wanted to do some shout outs before we begin. Wanted to shout out Mr. John Barton out there in Hendersonville. Thank you for stopping by the store. And wanted to thank the personal friends of the pharmacy, the Climbers, the Dukes, the Rose, and the Hawks family. I wanted to say hello to you all, and certainly the Edge family in East Nashville. I also wanted to say a big hello to my water customers coming all the way from the Pulaski, Columbia, Tennessee area. Miss Armstrong and Miss Greenlee, good to see you all. Thank you for coming by. Well, everyone, just want to let you know that this is your 1 hour forum where you get to call in with your questions and your comments or even your pharmacy nightmares. But rule number one, there are no stupid questions. So those burning questions that you're thinking about and you think that may be a little mundane, chances are someone else is thinking about the same thing, and you calling in and asking may benefit more than just you. So this is your forum. We do this because we know your doctors and your pharmacists are busy. They don't have time for this 1 hour. I do. Just wanted to give you a brief history on the show itself. It sprang from the Open Line series that I did maybe a little over a year ago with Kristen Presall, where they would have the Ask the Pharmacist segment to come in. So because of your support for that show, News Channel 5 Plus offered me this opportunity to focus solely on your questions, which is what we do here. And thank you for supporting the show for over a year now. Then the show, I guess about April of last year is when we did our first one. Here we are in May, and gosh, y'all, it's hot out there. So we're going to talk about water as we get into it. For those of you who are viewing this show for the first time, as is always the case, we'd like to welcome you, and we welcome your questions and your comments. Just a brief history about the store and kind of how we started. We started August 4th, 2012. On a mission to help those Middle Tennesseans, and there were roughly, I'd say about 100,000 plus uninsured Middle Tennesseans, according to a study done by the Tennessee Safety Net Consortium. So these people became the focus of our pharmacy. So we've been doing this for the better part of 2.5, almost 3 years now. So these are people who had to pay the full price of medication with no relief. These are people who many times had to go without this medication, go back to the emergency room, only to be prescribed something that they could not afford. So we try to cut the cost of medication for people who are uninsured or people who have insurance and sometimes their copays are still high. Also, people who want to be treated fairly, people who want to be treated with respect and kindness, something that some pharmacies have turned away from. And so we've been doing this. The second piece of our business we opened about 3 months after that is the Kangen Alkaline Water Store. And so for the benefit of those of you who have not seen the show before, Kangen Alkaline Water is water that goes through about 4 different processes. The first thing we do is we filter the chlorine out, we filter the fluoride out, which are your 2 major pollutants, toxins, cancer-causing agents in our municipal water. We also run it over titanium plates, which electrifies the water. And many people will say that they experience a tingling. That's because the water is electrified. It is actually living. But this also teams the water with antioxidants, which are your natural cancer fighters. And then the fourth piece, which is the most important piece of the water, is that we alkalinize it. We raise the pH from an acidic level of 6.5 up to an alkaline level, which is around 8 to 9.5. And so you may ask, well, what are the benefits of drinking this water? Well, I'll just say that the majority of the people who come to our store have issues related to having too much acidity in the body. And so having too much acidity in the body from your diet of high red meat, tomatoes, and other citrus fruit like tomatoes, orange juice, and what have you, without drinking the correct water, can manifest itself into a number of conditions. Acid reflux. There are a number of you suffering from gout, which is the formation of uric acid in your joints. And from what many of my patients tell me, that it is very painful. or arthritis. So what this water does is it neutralizes the formation of the acid in the joints, neutralizes the burning of the acidity in the stomach, causing the acid reflux, and basically taking away those symptoms. But not only that, people are coming in and giving me different testimonials about health issues that I had no idea that the water would be good for. I'm hearing fibromyalgia, I'm hearing menopause, I'm hearing depression, I'm hearing just an overall sense of well-being. The first thing that most people notice is that they go to the bathroom, and that is because once you start to lubricate that large intestine, which requires water to move and to clean you out, that's the first thing it's going to do. Kill that bacteria in that gut and then flush it on out. So many people ask, well, what does this water taste like? Well, the water, because it goes through about 3 different filtration processes, it has no taste, no smell. And not only that, the water texture is a very light texture. So you will notice that when you drink it, you're able to drink a lot of it simply because the molecules are so small, it absorbs readily into the body. And we sell a ton of it. I probably sell as much of that water as I do prescription medication. And those of you who come to the store a lot and you're watching the show, you can certainly testify to its benefits. And certainly want to thank those of you who out there who have been spreading it by word of mouth. There are a lot of word of mouth testimonials that you individually you've been telling your friends and your family members and loved ones, and they have been coming into the store. So I want to thank you, water customers out there, and those of you who have yet to come in yourselves, but you've recommended people to us. So a big thank you to you. Some people will ask, well, what does the water have in it that the regular water doesn't? And it's not so much what it has in it, it's what it does not have. And so we don't have a lot of the pollutants, the toxins. So when you look at a glass of our water when it comes out and it's clear, and then you take it from your sink and it may be a little yellow, and you may see some debris floating around in there. Water was not meant to be that way. In fact, the word kangen itself is Japanese for return to origins or return to roots. So this is the origin of what water was supposed to be. It was supposed to be alkaline. It was supposed to be void of chemical pollutants coming from either industrial waste or chemical treatment. So that's what water was supposed to be. I also wanted to talk about some simple things. Sometimes we talk about a lot of specific things on this show. So I wanted to cover some medication do's and some medication don'ts. So bear with me here, and this is for the benefit of some people, because sometimes we will assume things to be correct and they may not be correct. So the first thing that I advise everyone to do is to take your medication as prescribed. Your doctors went to school to learn how to diagnose and treat your condition, and so they understand how many pills you need per day, understanding the kinetics of the body and how long it takes this drug to move out. So always take your medication as prescribed. In fact, that's called compliance. So you comply with the doctor's orders. It's always going to give you an optimal result. And the second thing that you should do is call your pharmacist with any questions about your medication. Not your friend who's also on the same drug. And in some instances, you should not try to doctor on yourself without checking with your doctor or your pharmacist. Okay, but this show is about you, so we're going to get into some calls right now. We're going to get back to this because I think it's really important. But it looks like we have JC on line 1. JC, welcome to Pharmacist On Call. How may I help you? JC? Hello? All right. Okay, so we'll get back to JC there in a minute. So certainly you want to speak with your pharmacist about any questions you have about your medication. Sometimes you will have side effects and you may ignore them, or you may just take yourself off your medication. Always consult your pharmacist first. We are the drug experts, so we're going to be the best ones and the most qualified ones to answer your questions. But we're going to see if JC's on right now, so you hang right there. JC, welcome to Pharmacist On Call. How may we help you? JC?
Yes.
How may we help you?
Yes, I'm calling about a medicine, prednisone. That's a steroid medicine. How long can a person take that stuff for it to really, you have to stop taking it?
Depends on your condition. Now, there are certain conditions, like say you fell off your truck and you hurt yourself and you need something just to take the inflammation out of your body. You can do that for maybe 6-7 days, a week or so. You do a steroid taper along with some other pain medication. But if you have a situation where you have an autoimmune disease, you may have lupus or MS or something like that, where we're trying to keep your immune system from attacking the body, you will be on that for a number of years. Do you know why you're taking prednisone? JC? JC? Okay. Yeah. All right. Well, we're going to answer this question a little bit later once we get back, but we are up on a break. So you stay right there with those questions.